I hope I am audible to all of you. Okay, yes. Okay, so good evening and Assalamu alaikum. I hope you all are doing good. And today our topic is related to genetics, and we are going to cover important topics which are related to AKP exam. Some of the topics are included in AKP, which are also was also important for FOP and TAS, which might you have been gone through it, but we need to do it in more details because some of the new syndromes, not new syndromes, but some of the different syndromes are important for AKP exam. So let's get started. Um, okay. Just a second. Okay. Yes. Okay, so first we are going to discuss about types of chromosomal abnormalities according to the numerics and according to the structure. Okay, so when we talk about the chromosomal abnormalities, okay, so that could be numerical abnormalities. That means if we have 46 number of chromosome in a person, and we have one X chromosome in that, and then one Y chromosome, these are the sex chromosomes. So if there is any extra chromosome or any missing chromosome, okay, so that is considered as the aneuploids, and that is a numerical abnormality we say. Okay, so aneuploides are those either contain extra chromosome, so it will make 47 if extra chromosome, okay, or any missing chromosome that would make 45 number of chromosome, and it depends that whether the chromosome is the somatic number or it is the problem in the sex chromosomes. Okay, so we have a different variety of it, so let's go through it. Like monosomy. Okay, so monosomy means that like among sex chromosome we have one X and we have one Y. Okay, or we have XX. Okay, so this is for males and this is for girls. So when we talk about monosomy, so in monosomy there is one chromosome is absent, and that is the sex chromosome. Okay, so when there is one sex chromosome is absent, so it is denoted as XO, and that is the total number of chromosome will be 45 numbers, and this is Turner syndrome. So monosomy, an example of monosomy is a Turner syndrome. Those they have 45 number of chromosome, one X chromosome and another X chromosome is absent. Okay, Turners are usually girls. We are going to discuss this topic in detail as well. Now coming to trisomy. Okay, so disomy is normal thing that we have XX or XY, but trisomy means that we have three copies of one chromosome. Like not even the sex chromosome, if we talk about the other somatic chromosomes as well, so each chromosome has one copy of it. That means there are two chromosomes in number, so there is a pair of chromosome present. All right, so when we talk about trisomy means that instead of two chromosome, instead of a pair of a chromosomes, they have triplets, they have three copies of a single chromosome. Okay, so that is known as the trisomy, and this is like we say that okay, one extra chromosome is there. So trisomy, Down syndrome. Okay, so Down syndrome has three copies of number 21 chromosome. Okay, so chromosome number is 21, but it has three copies of 21 chromosome. Okay, so that is Down syndrome. If there are three copies of 13th chromosome, okay, then this is Pachu syndrome. If there is three copies of 18th chromosome, then we have Edwards syndrome. Okay, now these are for the somatic chromosomes we are talking about. Now, if like just like Turner syndrome, if we come to the sex chromosome, so if we have any sex chromosomes which is increase in number which is extra, okay, so that will be Klinefelter syndrome, and it has 47 number of chromosome. It will have one X extra. So one X extra. Okay, usually males have X and Y. Okay, so it will have one X extra, so that will make XXY. Okay, so total number of chromosome in a body would be 46 chromosome, but when the child has a 47 number of chromosome and that is one X extra, so that is Klinefelter syndrome. So these are known as the aneuploids. Okay, so we have discussed the monosomy and trisomy. Now we are going to discuss all of these one by one, which will be important for AKP exam related to the clinical features, okay, and that could be asked in AKP exam, and related to some of the referrals, some of the follow-ups, okay, of the Down syndrome, especially because this is the most commonest one. Okay, so whatever I have seen in the recalls are important, so I have put that in the lecture. Okay, so let's get started with it. Okay, so I'm sorry about it. We will discuss about the structure abnormalities also. Okay, so just before jumping towards the topics, okay, so we are going to discuss about the structural abnormalities, that what type of structural abnormalities we have. Okay, so regarding structural abnormalities, like that was the numerical abnormalities I talked about. Okay, so these are the structural abnormalities. Now, depending on the type, like what structure is missing, okay, so there are certain definitions which you have to keep in mind. Now, this is for your understanding also. This was important for TAS exam also. And now in AKP exam, when I have seen the syllabus, okay, so it says that you should have an understanding of the pattern or of inheritance and patterns of chromosomal abnormalities. Okay, so you should know that what are translocation, insertion, and deletions. Okay, so translocation, what we say a translocation, a portion of one chromosome is transferred to another chromosome. This is how it causes, like this is one chromosome, when the portion of the chromosome goes and attaches to the another chromosome. Okay, this is known as the translocation. Okay, now there are certain types of translocation which we're going to cover in the next slide. Okay, different type of translocations, which is balanced, unbalanced, Robertsonian translocation, which will be important for Down syndrome. Okay, then we have insertion. What is insertion? A segment of the chromosome is inserted into another position on the chromosome. So once one section of the chromosome is broken up over here and it goes and attached to the another one. This is known as the insertion. Then important one will be deletions, because there are certain syndromes, we have Jabeerah syndrome. So these are certain syndromes which are deletions. Okay, so deletions, portion of the chromosome is missing. In deletions, this is the deletion. Okay, so one segment of the portion is completely deleted and then they rejoin together to form this. This is known as the deletion. Okay, just like 22q11, which is an example of a Jabeerah syndrome. Then inversion, a portion of chromosome broke off. Okay, so the portion of chromosome broke off and turn itself, okay, inverted itself and gets attached to it again. Okay, then we have duplication. So duplication is a part of chromosome is duplicated and present as an extra genetic material. So this part duplicate itself, doubling occurs, okay, and then rejoined into the chromosome. Okay, so this is known as the duplication. Circle is the chromosome has formed ring with or without loss of gene. Okay, so these are some of the basic definitions which you should know, that what sort of structural chromosomal abnormalities we have. Okay, regarding the translocation, okay, that there are two basic type of the translocation during meiosis. So for TAS, we did my meiosis 1 and meiosis 2. So in the process of meiosis, basically, the cell divides into four. That one cell divides into four, okay, and to get fertilized to another one. Okay, so this is for the sex chromosome. So during meiosis, chromosome pairs and separates. Okay, break it fragments which join to make another chromosome. Okay, now there are balanced translocation and unbalanced translocation. Transfer of genetic material. Okay, so you see transfer of genetic material in which there is no gain and loss of genetic material. Number of chromosomes remains same, does not have any apparent in genetic syndrome, but can pass to offspring. Now, the example of this is the example of the balanced translocation. So you can see two pairs of the chromosome over here. Now the fragment of each of them is broken, okay, and then they get reattached to one another, but you can see the genetic material does not changed. Okay, they remain same. There is no loss or gain in the genetic material. So in this situation, okay, they do not appear as any syndrome. Okay, so this is known as the balanced translocation. Okay, then we have unbalanced translocation. So unbalanced translocation, transfer of genetic material either with deletion or duplication. Unbalanced number of chromosome will be occurring and genetic syndrome will appear. So this is an example of the unbalanced translocation. That is before translocation. What is like chromosome 4 gets broken up, okay, and then it goes and attached to the another chromosome. So there is a gain of genetic material in chromosome 20, and there is a loss of genetic material over here. Okay, so this is known as the unbalanced translocation. Okay, now one terminology is the Robertsonian translocation, which we can see in Down syndrome especially. Okay, so Robertsonian translocation, when translocation is occurring in chromosome number 13, 14, 15, 21, and 22. We know that Down syndrome occurs when there is three copies of the 21 chromosome. Okay, when these type of translocation is occurring in these chromosomes, okay, so this is known as the Robertsonian translocation. So in Down syndrome, if one parent is balanced Robertsonian translocation of chromosome 21 and 14, okay, and then parent itself will be normal but can pass the unbalanced Robertsonian translocation in offspring. Okay, so you see over here that this is a normal parent, one parent is normal, okay, another one has a balanced Robertsonian translocation, that the person is a carrier, doesn't appear as a Down syndrome because the genetic material is same, okay, but it is reattached to another one. Okay, so in this situation there is autosomal recessive type of inheritance, okay, and some of them will be carrier offsprings we are talking about. So some of them will be carriers, some of them will come as a syndrome, okay, and some of them will be normal. So you see that Down syndrome will come when there is three copies of the 21, because purple one is 21 chromosome, okay, so this is the 21 chromosome, and this one is the 13 chromosome, and this is the Robertsonian translocation in which the 13 is attached to the 21. Okay, so in this situation you see this is the normal chromosomes we have, in this we have Robertsonian translocation. Now when we make the crosses, we see that we have Down syndrome, 50% of them will be Down syndrome, one will be normal, and one will be a carrier. Okay, so you see that three copies of the 21 syndrome will be here, three copies of the 21 syndrome, 21 chromosome will be here. Okay, here you will see that again there is a Robertsonian translocation carrier and one will be normal. So that means that Down syndrome can occur as a Robertsonian translocation. In such situation, there can be an inheritance into the offspring. Otherwise, if it is other mechanism like non-disjunction, okay, or mosaicism, okay, so these are other two mechanism which by which they can come. So in such situation, they are not inherited. Okay, they are come according to the age of the mother. All right, so this is Robertsonian translocation. Okay, now coming to the Down syndrome. Okay, so Down syndrome, what is Down syndrome? So again, Down syndrome has three copies of 21 chromosome, and that is the reason why it is known as the trisomy 21. Okay, total number of chromosome when we talk about, so they have total number of chromosomes which are 47 chromosomes, one extra chromosome. Okay, clinical features are very important for Down syndrome, so you have to remember and memorize the features. Okay, now there are certain features of each syndrome which you have to keep in a mind as a key feature, because there are a lot of features and obviously you cannot remember each and everything. So the one which are key features of each syndrome, I have highlighted those in bold so that it remains in your mind. Okay, so head and neck, when we talk about head and neck, so there will be flat occiput. Okay, so flat head will be there from back, round face will be there. Okay, this is important. Short neck will be there. Protruded tongue is very important. They have macroglossia. Okay, small mouth but enlarged tongue sticking out. So this is very key feature. Fine and sparse hair. Then epicanthic folds are very important. So epicanthic folds are upgoing. Okay, so epicanthic fold, these are the epicanthic flow. Epicanthic folds can be seen upper at the eyelid. Okay, and then up slanting eyes. Okay, so up slanting eyes will be there. This is known as the mongoloid eyes. Okay, and this is very important for Down syndrome. Now in eyes they have a specific thing which is known as the brush field spot. Now this can come in the picture in AKP exam. If you see, you can see the whitish color spots, if you can see. So these are the spots which are known as the brush field spots, and these can come in the Down syndrome. Okay, then we have flat nasal bridge, small eyes and low set ears, very common in other syndromes as well. Coming to the limbs, now limbs have some certain specific features, like they are short and broad hand and feet. Now sandal gap is there. Okay, so in feet they have big toe sandal gap. So this is a big toe sandal gap which we can see. They have curved small little finger. Okay, and they have single palmar crease. So this is also very important feature, that they have a single palmar crease in their palms. Normally child don't have single palmar crease, but they do have. Okay, so these are some of the features. Then other features are like they have mental intellectually problems. Some of the associations are there, some certain complications are there, so we are going to go through that as well. Now these were the ones which we did was the physical features which were looking. Okay, now we are going to talk about the associated problem which Down syndrome have. So Down syndrome, first of all, they are going to come with the cardiac problems, congenital heart diseases. Now the most common congenital heart diseases is the AVSD. Okay, then coming to the VSD, and then TOF exam. You must have done all these in the cardiology chapter. Okay, that how it presents VSD, AVSD, and TOF. So in AKP exam, the question can come like child has a Down syndrome and has these features, and then you have to dig out that what type of congenital heart diseases they have. Okay, so that is the topic of the cardiology chapter. Okay, then if the child is Down syndrome, okay, so we know that there is a risk of having congenital heart diseases. So according to the guideline, ECG should be done soon after birth. Okay, and depending upon that whether the ECG is normal or abnormal, okay, we are going to refer the child for echo. Okay, so if ECG is abnormal, a referral for echo within 2 weeks. Okay, and if ECG there are no changes, referral for echo within 6 weeks. So it depends that whether there is any urgency or not. Okay, so if ECG changes are there, then within 2 weeks, and if ECG changes are not there, then refer echo for echo within 6 weeks. So this was written in one of the NHS guideline which I gone through. Okay, then other associated problems can come as in duodenal atresia, Hirschsprung disease, hypotonia, delayed motor milestone, learning disabilities, increased susceptibility to infection. Now, other associated problems, how they can come in the exam, they can ask you like the child has Down syndrome, and then they will give you the features of these problems, and these are associated with their specific chapters. Okay, so we'll be doing that in the like GIT, Hirschsprung disease and duodenal atresia in the GIT. So you should be knowing the features of that, so you will be able to pick that diagnosis. Okay, so but you have to keep in mind that okay, Down syndrome has these features. Okay, then we have later medical problems, that are the complications. Okay, so those were associated problems that Down syndrome can come with it. Okay, and now these are the complications they can have. Okay, so a lot of complications are there, and we will be moving from head to toe just to keep in mind and make ourselves remember these. Okay, so starting from the eyes. Okay, so eyes, they have congenital cataract, very important. Visual impairment will be there, then squints can be there, and myopia, nearsightedness can be there. Then ears they will be having hearing impairment due to secretory otitis media. Respiratory, they can come up with the obstructed sleep apnea, obviously because they have hypotonia, they have macroglossia. Okay, so during sleep they can come up with the obstructive sleep apnea. Then in GIT, they can come up with the celiac disease. Okay, then endocrinology, hypothyroidism is common. So if in celiac disease, they will come up with the symptoms and features of the celiac disease. Then endocrinology, hypothyroidism, CNS, epilepsy, Alzheimer's disease, MSK, hip dislocation and skeletal instability, and risk of leukemia and solid tumor. So a lot of questions are there in which they give you the pancytopenia in Down syndrome. Okay, so we have a risk of the leukemia. Okay, so depending on what features they are giving in the exam. Now this is the another thing which you have to keep in your mind regarding the follow-ups. Okay, so this wasn't that important in formal test exam, but this is important for AKP exam, that because there are a lot of associations, there are a lot of complications in the Down syndrome syndrome, so they go through health checks. Okay, so special health checks on the specific age group. Okay, so we have like thyroid blood test for the hypothyroidism. Okay, so first of all, newborn check. Okay, so from birth to 6 weeks, so there will be newborn check. And then we have age groups over here, so special checks under 2 years of age. Okay, then preschool check, so that is less than 5 years of age. And school check, school age is 5 years. Okay, so preschool checks will be less than 5 years, and school age is 5 years onwards. Okay, now thyroid we are going to check from age 1 year. Thyroid function should be discussed annually. So thyroid function is the test which we should discuss annually using the results of either annual finger prick TSH test. So if we are doing finger prick TSH test, so we have to do the annual results, and thyroid blood test including thyroid antibodies, that would be 2 yearly. Okay, but they say that thyroid function sets should be annually. Okay, then we have eye checks for the congenital we have a congenital cataract, myopia, okay, and visual impairment. For that reason we do eye checks. Okay, so newborn check first of all. Okay, so including congenital cataract check. Then at age 18 to 24 months, so formal eye and vision examination, including check for squint and refraction for long or short sightedness, which we did that these can be a complication of the Down syndrome. Then age four will be again formal eye vision examination, including check for squint, refraction assessment, near and distance. So same thing. Okay, so at 18 to 24, that is 2 years or approx, then age 4 years of age, and then we have to repeat these vision tests every 2 years. So this is every 2 years, okay, which is recommended by the optometrist and the ophthalmologist. Okay, so eye check will be in the newborn, then during approx 2 years, and then 4 years, and then every 2 years. So we see the pattern how it going. It is moving towards like 2 yearly. Yeah, 2 yearly in short. Yes. So 2 yearly we are going move on. Okay, so visual behavior to be monitored at every review, particularly in the first year. Okay, now next we are going to talk about hearing checks. Okay, so which is the audiology we are going to do. Okay, so hearing checks, birth to 6 weeks, universal newborn screening will be done. Okay, then we have special checks under 2 years, full audiological review by 10 months. Okay, including test and impedance check. Then preschool checks. Now preschool checks will be less than 5 years, I told you. So if the child age is less than 5 years of age, so it is recommended to check the hearing annually. Okay, so annual audiological review as before. Okay, and once they have reached 5 years, okay, then 2 yearly checking of the hearing. Okay, then coming to the growth monitoring. Now growth monitoring, they say that all the length, weight, and head circumference should be checked frequently and plotted on Down syndrome on the growth charts. Okay, so that is like at under special checks under 2 years. And then when they like after 2 years, because the growth chart is moving as a growing thing. Okay, so they said that at each visits they should be checked at the BMI. Okay, so height and weight should be checked and plotted on Down syndrome growth charts. They have a special growth charts which are known as the Down syndrome growth charts, because they are compared to those children who are associated with the Down syndrome. They are not compared to the normal child, so they are plotted on their own growth chart, which is known as the Down syndrome growth chart, at least annually while growing. BMI checked if concerned regarding overweight. Okay, next we have heart checks. Okay, so heart checks. So again, I told you that by age 6 week, formal heart assessment, including echocardiogram. So, but the guidelines say that if they have abnormal ECG after birth, so it should be done within 2 weeks of age. Okay, then at all ages, low threshold for reviewing heart status. Like if they are coming with the clinical symptoms, then only we have to review the heart status. Okay, then we have from adolescence onwards. So as a part routine health checks, listen to the heart for sign of acquired. So that means we'll be doing echo only soon after birth, depending upon the ECG. And then we are going to keep an eye, okay, on their sign and symptoms if anything, if any review is required. And then after the school age, we are going to only in each visit we are going to only hear the heart for any acquired heart diseases. Okay, then coming to the breathing checks. So inquire at every review for uneven breathing during sleep and poor quality sleep, a low threshold for further testing using sleep studies. Now these breathing checks are for the obstructive sleep apnea basically. Then blood checks, so newborn blood test to check abnormal blood film, that is for the leukemia. Okay, so for the blast cells they are talking about over here. If blood film is abnormal in first 6 weeks, okay, so follow up or repeat blood testing may be necessary until age 5. So these blood checks are for the leukemia, and they are talking about the blast cells over here. So these are the recommended NICE recommended follow-ups which you should keep in mind. Now, if we talk about the AKP exam, they have asked about the annual reviews, and annual reviews are most likely like thyroid exams over here, which is recommended. Okay, and then we have the audiology. Okay, then we have the growth monitoring. Okay, so these are some of the reviews which we should do annually. Okay. Okay, now moving towards the risk of reoccurrence. Okay, now this depends upon the mechanism of the Down syndrome, that whether it is going to reoccur or will be inherited in the offsprings or not. Okay, because in AKP exam, in AKP syllabus, they mentioned that you should be able to understand the inheritance of the syndrome. Okay, and you should be able to reassure the parents or give advice to them regarding the inheritance. Okay, so risk of reoccurrence depends on the mechanism of the Down syndrome. Now, mechanism of the Down syndrome could be meiotic non-disjunction, mosaicism, or unbalanced Robertsonian translocation. This I have already explained, that what is unbalanced Robertsonian translocation, which can transfer the disease to their offsprings. Okay, coming to the meiotic non-disjunction, so this is very simple thing for we did for TAS. Okay, a whole of the topic was there for TAS, so I'm not going in that much detail. But we have meiosis 1 and meiosis 2 is there. Okay, and the process basically what it does, that though there are 4 chromosomes over here. Okay, and there should be one in each 4. Okay, now if in any step, okay, there is non-disjunction, that means they are not dividing into two just like this. Okay, so what will happen, there will be empty over here, and there will be 2 chromosomes in each of them. Okay, when they fertilize with 1 chromosome, they will make 3 copies and result in the Down syndrome. This is known as the non-disjunction. Okay, and again, if the non-disjunction is taking place in the meiosis 2, okay, that means that these 2 chromosomes are not separating. Okay, suppose this one has separated in single chromosome, but this hasn't separated in single chromosome, and there are 2 chromosomes in one, and this again when fertilized to one single, so there will be 3 copies again. So this is known as the non-disjunction in meiosis. So if there is non-disjunction in meiosis, okay, so this means that it depends on the maternal age group. Okay, so whether, like, because there is a high risk when mother age is 40 and above to have a Down syndrome child. So 1% risk of reoccurrence, it only depends on the maternal age related risk, whichever is higher. Okay, then mosaicism is a milder phenotype. Mosaicism depends because some of the cells are affected and some of the cells are not affected in mosaicism. So milder phenotype, 1% risk only will be there of the recurrence. Now, most important one is the unbalanced Robertsonian translocation. When a child is coming with the Down syndrome, so we do testing, okay, and we do the karyotyping to see the mechanism, that what is the mechanism behind that. Now, if the mechanism comes as an unbalanced Robertsonian translocation, so then we have to reassure the parents, and we have to make the mind of the parents that okay, so we can have other children with the Down syndrome also. Okay, and it could run in the family. Okay, so because there will be a risk of reoccurrence. Okay, so now depends that what type of chromosomes we can see in the unbalanced Robertsonian translocation. Now, if it is 2114 chromosome or 2122 chromosome, so unbalanced Robertsonian translocation are occurring in these two. Then if father is a carrier, then 2.5% is a risk. Okay, and if mother is a carrier, then 10 to 15% is a risk of for having the child. Then if there is 21 chromosome translocation, okay, so this means if either mother or father is a carrier, there will be 100% risk to have a child with an offspring, child with a Down syndrome. Okay, so this is risk which you have to remember. This is important for TAS, AKP, even clinical exam also, because this is usually asked in the communication for the clinical exam. Obviously, once you have passed your AKP exam, you'll move towards the preparation of the um, clinical exam, and it will be very important to make your basic concepts good to go through the communication station. All right. Okay. Maternal age related risk. Okay. So we know that Down syndrome, higher the maternal age, higher the risk we have. Okay. So this is the maternal age related risk. And we can see that once the mother reaches the 35, the risk basically increases. Okay. So 1 in 1530, 1 in 900, 1 in 385. Now, 1 in 385. 37 years of age, 1 in 240. 40 years of age, 1 in 10. Now this is the high risk. Okay, so 41 in 110. Okay, so this is the high